Very good morning. The content of of today is on radiation biology. So, radiation biology is nothing but it is defined as the study of effects of the ionizing radiation on the living system. The biological effects is basically because of the effect of ionization. So, it can be either direct or indirect. Direct is nothing but the photons, X-ray photons will directly interact with the biological macromolecules directly into the body cells. Whereas indirect is like the photons interact with the water and the products from the ionization of water will cause a biological damage. It is also, there is one more classification on effects of biological effects of radiation, which is deterministic effects and stochastic effects, which will be seeing in detail in the further slides. So direct action is, as I said, it directly interacts with the DNA, RNA, or the proteins, biological macromolecules. So it can cause changes or mutation or chromosomal aberrations in the DNA, and the further causing the effects on the stomatic cells and the reproductive cells, which could be of a congenital mal alignment or congenital abnormality, and some radiation induced malignancies. An indirect action, as I said, it will be ionizing the water molecules, which will release toxic products and free radicals, which will be affect these toxic products and free radicals will be affecting the cells. So the effect of radiation on water, which causes ionization of water, is known as hydrolysis of water. So the water molecules on interacting with the X-ray photons on ionization will form H plus and OH minus ions, which are known as free radicals. So these free radicals will combine to form toxins like hydrogen peroxides, which will in turn affect the DNA, will affect the DNA and macro. So effects on the DNA and RNA based as I said, it will be causing base pair damage. It can affect either cause breakage of single strands or the double strands, both the DNA or DNA protein cross-links. So as classification of biological effects of radiation, it based on the duration, how long we have been exposed to radiation. It can be acute exposure, which is the sudden exposure of large dose of radiation. Example of that is kind of a nuclear accident which happened in Hiroshima and Nagasaki. The people from that place still continue to carry the effects of this ionizing radiations. And chronic exposure is like a small quantity of radiation, small, very minimal quantity of radiation exposure for over a period of long time. Example is like dental X-rays, which is like very minimal quantity being exposed, and the exposure is for a long period of time, like minimal quantity in a long period of time. And based on the threshold, it is classified as stochastic effect, which is like there is no minimum threshold. Even a small amount of radiation will have some effects in the cells or the tissue. So this is no, it is no, it can cause sublethal DNA damage, and it is the severity is independent of the dose. It is not proportional to severity is not proportional to the dose. It is not all or none response. The individual may either manifest or he may not develop any complications. Higher the dose, higher the risk of manifesting the effects. Example would be radiation-induced cancer, heritable effects, radiation-induced skin cancer. So stomatic damage and genetic damage. The stomatic cells, the radiation would affect the stomatic cells like thyroid, esophagus, brain, nervous system, salivary glands, and other organs like skin, bone marrow, paranasal changes. The later effects would be growth and developmental retardation, mental retardation, or cataracts. Even it is affecting the DNA material, reproductive cell, it would affect the germ cells of the reproductive organ, which would in turn will be affecting the subsequent generations. And deterministic effects of tissue reaction, just like the when the radiation dose exceeds the certain limit, okay, then they would be causing deterministic effects. Whereas stochastic effects is like small. Whatever the quantity, whatever the dose is exposed, that will be affected. And this is like when it exceeds a certain limit, beyond that limit, if there is an radiation exposure, there will be a damage. Higher the dose, the more the severe the effect is. So these are the examples of these kind of reactions or effects: radiation-induced cataract formation, osteoradionecrosis, radiation-induced skin burns. It can be of two types: early tissue reactions and late tissue reaction. Early tissue reactions is shortly immediately after the exposure. Example: skin erythema or mucositis. Late tissue reactions which appears months or years after exposure, which is known as osteoradionecrosis. The rule that is being followed by deterministic effect is known as law of Bernoulli or a triband rule. It is like radiosensitivity to cooling is proportional to the mitotic rate or the differentiation. So basically, it is like the cells which are more sensitive to the radiations, like reproductive cells and lymphocytes and bone marrow, will be manifesting the effects more faster than the other cells. So the rule is that the rapidly dividing cells will be more radiosensitive and post-mitotic specialized cells will be more resistant. So bystander effect is nothing but when there is no direct exposure, when there is when the patient is treated with radiation therapy, the cells that are surrounding the area that is being the therapy is being concentrated, and those cells will also have some changes. This effect is known as bystander effect. It can be short-term effect and long-term effect. Short-term effect is like for few hours and days, where there is a reduction in the number of mature cells. The long-term effect would cause long-term effect is like it would affect in the vascularity and it could cause degeneration and necrosis. Radiosensitivity. Radiosensitivity is defined as the ability of radiation to biologically change or alter the cell, which can be either cell killing or destruction of the reproductive capacity of the cells. The human cells are classified as high sensitive, intermediate sensitive, and low sensitive organs. The highly sensitive cells or organs are lymphoid organs, bone marrow, testes, intestine, and mucosa membrane. Intermediate sensitives are fine vasculature, that is blood vessels, growing cartilage, growing bones, salivary glands, lungs, kidney, liver. And low sensitive are optic lenses, mature erythrocytes, muscle cells, and neurons. So basically, the deterministic effects on the embryos of fetus is like it could affect the reproductive or the developing capacity. It would cause any mutation or the congenital changes. Okay, so when there is a radiation in the peri-implantation time, then it could cause abortion or embryonic death. If the radiation is between 8 to 15 weeks of gestation, there will be more affected on microcephaly, and in between, if the radiation is the exposure is between 8 to 25 weeks of gestation, there will be mental retardation. Basically, it will be affecting the brain cells and the developing neuronal cells. Coming to the general effects of radiation on skin, early effects would be like chapping, brittleness, or any deformation in the fingernails. Late effect would be loss of hair or epilation of the hair, dryness or atrophy of the skin, pigmentation, keratosis, ulceration with potential macular changes. In eyes, there will be epilation of or loss of the eyelashes. We will be losing the eyelashes, drooping of eyelashes, inflammation, fibrosis, decreased sensitivity of the eyelid, and that is made majorly because of the fibrosis of the eyelid, of the muscles in the eyelid, ulcerations of cornea, and cataract formations. In here, it would cause the desquamation of epithelium, edema of mucosa, and also for radiation otitis media, deafness due to rupture of the eardrums. In testes and ovaries, it would suppress the reproductive capacity of the activity of the cell, and there will be alteration in the fertility and functional changes in the offspring. Cataracts, it's like affecting the lens of the eye. Ionizing radiation would affect the lens of the eye, causing clouding or opacification of the lenses. The observed doses in the normal normal radiographic techniques used in dental, it would be very minimal, that is like 0.02 to 0.4 milligrays cube. Effects of radiation or radiotherapy in the oral cavity. As radiotherapy is the indicated treatment for any malignancy, there would be side effects or the effects of the radiation therapy in the oral cavity. So coming to the mucosa, it will cause severe oral mucositis, which is like there will be like slug-like formation and severe ulcerations, desquamated epithelial, and which would cause severe discomfort and difficulty in food intake. On top of that, there would be they could happen to have a secondary infection, that is candidiasis. So after the completion of treatment, it heals rapidly within 2 months. Okay, and there would be any fibrosis of the connective tissue. That's why there is the common complication would be difficulty in opening the mouth or testis. And the radiation would also affect the taste buds, where there is loss of taste during the second and third week of the radiation. That, however, the taste perception would regain after the completion of the radiation. It is mostly reversible, and it would take around 2 to 4 months for recovery. And for salivary glands, it would affect the ability. Salivary glands are intermediately sensitive cells, so it obviously affects the salivary production and thereby reducing the salivary flow. And there could be also fibrosis and decreased vascularity to the gland, which imposes a major problem for gerostonia. And the other few effects on the teeth would be, mainly since the salivary flow is affected, the teeth are more prone to caries, and the oral hygiene is affected. There is no cleansing activity of the saliva. There would be more of food lodgement and more of plaque formation, which would cause radiation caries, mainly in the cervical regions. Radiation caries are dark pigmented caries lesion in the cervical, which will be affecting the cervical area. Then this is mainly because there is a reduced salivary flow and the pH is being decreased, and so the buffering capacity is decreased, and there is an alteration in the microflora in the oral cavity. And when there is a radiation exposure during the development or in the initial years, it would affect the development of the teeth bud. It would cause any developmental anomalies in the developing teeth. Muscle issue, as I said, it will cause trismus, which is mainly because of inflammation and fibrosis of the masticating muscles. It will be like there will be a restricted opening. And coming to the effects on bone, the primary damage is to the measured bone, and the radiation is split. Like, it will affect the vasculature or the blood supply to the periosteum and the cortical. On long-term exposure, the major and very well-known complication is osteoradionecrosis, which is the late complication. Osteoradionecrosis is defined as an area of exposed irradiated bone tissue that fails to heal over a period of three months without any residual or recurrent. This is because of microvascular changes, that is because of hypoxia, hypovascularity, and hypocellularity. This bone destruction can be radiographically seen, which has patchy radiolucent areas with radiodense islands of necrotic bone or sequestrum. So osteoneinosis typically manifests for 6 to 12 months following the radiation and is more frequent in the mandible than the maxilla. So this is a picture of a necrotic exposed necrotic bone sequestrum in case of osteoradionesis. Coming to the care, what should be followed post-therapy, pre-therapy and post-therapy. Pre-therapy, if there is any, if the oral hygiene should be completely taken care of, and if there is any grossly decayed teeth or any caries teeth, the treatment should be done before, because later treatment of extraction of grossly decayed teeth would increase the risk of osteoradionecrosis. So the caries teeth must be restored before the radiation therapy. Good oral hygiene, and to prevent, since there is chance of radiation caries, to prevent that, topical fluoride application is must. Teeth with extensive caries or poor periodontal support must be extracted, allowing for it should be done 2 to 3 weeks prior to the radiation, before beginning the radiation. And post therapy is like regular periodic checkup to be followed, and if there is any occurrence of radiation caries, it should be detected early and treated. And extraction if there is a necessary to extract any teeth in the irradiated area, it should be taken without any trauma. There should not be much of trauma caused to that region. And then just if there is any adjustment to be done, it must be done and given to the patient. And there is something called acute radiation syndrome. This is like whole body radiation, sudden exposure of the whole body, which would have severe effects. This is what would have happened to the people who have been exposed to Hiroshima and Nagasaki. Okay, so initially, when it starts with the stages like prodromal symptoms, like there will be mild changes in the blood, which is decrease in WBA. Then there will be a mild hematopoietic changes, like within like few hours after the exposure, there will be vomiting, and there will be loss of appetite, fatigue, and blood changes. This will recover, which might recover, they might recover, and there will be if there is so much exposure that it causes severe hematopoietic. This will cause vomiting, severe blood changes, loss of hair within 2 weeks, and recovery might take 1 month or to 1 year. And if there is a gastrointestinal symptom, the vomiting, intestinal damage, and severe blood changes, and mostly it would result in death. And if there is more exposure more than 10 cyber, it will cause changes in the cardiovascular and central nervous system, causing brain damage, coma, and death. So hope this presentation was useful, and thank you.